For our project, we have the psychology of athletic injury and recovery. My name is Charles Winchester.
I'm Conally, Webb. And I'm Lissette, Garcia.
The first thing I'm going to talk about is the risk of sports injury. A question to focus on is, what if an athlete's risk of sports injury can be predicted by their personality type? It is often found that many people don't think there's a link between personality type and athletic risk. However, personality factors and other psychological factors do not predict athletic risk, but there is a strong correlation between one psychological factor, stress, and athletic injury risk. So if you have more involved, such as more stress in your life, it can increase your risk of injury. As far as stress is defined as the demands of a situation exceeding the resources to respond to those demands. Some signs and symptoms of stress that you'll find are related to behavioral, physical, and psychological factors. A little bit about each one of those is behavioral. That is more involving sleep difficulties, feelings of being overwhelmed, and then substance or drug abuse. For physical, you'll have illness, sweating, headaches, change in appetite, negative self-talk, and lack of confidence and self-doubt. Psychological, you'll have your negative self-talk and then lack of confidence. All those, if you have a lot of those present in your life, can lead to higher risk of injury. Next thing I'm going to talk about is the Williams and Anderson model. This is what was covered in my database article, which was titled "Risk Response Recovery: Psychology of Sports Injury" by Forsythe. For this, he analyzed the risk of sports injury as well as responses to sports injury and how stressors impact your risk of injury. At-risk personality variables include poor self-esteem, high anxiety levels, risk-taking, and hardiness. The number of key factors contribute to an athlete's risk of injury. It is thought that an athlete's history of stressors, personality, and coping resources all come together to affect their cognitive appraisal of a particular incident, leading to adverse stress response and subsequently sports injury. As I was reading the article, I felt that they did a really good job in relating this to the actual athletic injury. However, I felt like they could have improved by showing real-life examples, more specifically with maybe more professional athletes that some people may know of who have utilized coping techniques to alleviate the stressors in their life to limit their injury risk, with addition to proper training. The next thing I'm talking about is the grief model. This was also included in my article. Many of you have heard of the grief model. It also is used in sports injury. A lot of recovery does deal with the mind more than just physical, actual therapeutic exercises. So in order to get to that part, you have to go through the grieving cycle in order to accept your injury and progress from there. The grief model was developed by Kubler-Ross and explains the stages of grief. The specific stages of grief are denial, anger, bargaining, depression, and acceptance. For denial, you'll find things such as you refusing to accept the injury. It may be very shocking for you, however, they have that constant feeling of that it really cannot be happening to them, and they don't accept the injury initially. This then progressed to the anger stage. This is where they either blame others, blame the coach, and are often very angry at the situation. You may find aggressive behavior or storming away. Then this brings you to bargaining. Bargaining is you start trying to figure out ways to make the situation better rather than dealing with the reality. So basically an example would be if you do more, I'll recover faster, and then coach will allow me to play. And then you may even disagree with the therapist that you're working with and think that you know your body better. So you'll find things such as failure to follow advice, and then you'll have the dangers of overmotivation. The next stage is depression. This is a very important stage because it kind of leads into acceptance. For depression, you realize that the injury is there, it isn't getting better, so you may even like start to quit on the actual recovery process. So you may find things such as withdrawing from the team or therapeutic exercises in general with a therapist that you're working with if you're working with them. And then this leads me to acceptance. This is the most important part of the grieving cycle because in order to move on from the injury and progress, you have to accept the injury. So you'll take advice from others, and then you accept your injury, and you may have the thought of coming back better than you were before. Many professional athletes have gone through this, and it's very important to make it through.
So what I'll be talking about is problematic emotional reactions. This is when an athlete first gets injured, their initial reaction can be shock, anxiety, and denial. And when the athlete goes into shock, it can be depending on the injury, debating if it's a season-ending injury. Also, having anxiety is when the athlete wonders about the pain and questions when will they be able to play again or if they will be able to play again. And some will keep training, denying there's discomfort, possibly even hoping it will go away or resolve themselves. So they will just ignore the injury and just keep playing and see if it can like fix on its own. Some coping and reactions may include depression and or anger when the athlete gets injured. Some will begin to put the blame on themselves for the injury, which causes a lot of sadness and depression. And if anger is a factor, they may start blaming the people around them for the injuries, such as their coach and teammates, and so on. And then some problematic emotional reactions, examples would be persistent symptoms will be altercations of appetite, sleep disturbance, and irritability. Some worsening symptoms would be altercations of appetite into disordered eating, sadness into depression, lack of motivation into apathy, and disengagement into alienation. And some excessive symptoms would be pain behaviors, excessive anger or rage, frequent crying or emotional outbursts, and substance abuse. So techniques for coping with stress. So you need to maintain a positive attitude throughout the whole process and basically like tell yourself that you can do it. Learn about your injury, like know what's going on with your body and how you can like get better so you can get back on that field faster and really just work hard to get where you need to be. Get support from your friends, family, and your athletic trainer and your physical therapist as well, because those are the people that are going to get you through all this and be your biggest support group through it all. Set goals to get back from your injury sooner. So set goals each week saying like, oh, this week I'm going to be able to do, like, say you tore your ACL, like I'm going to be able to bend my knee this week. I'm going to be able to like walk on it, put a little bit of pressure on it this week. And then do the PT exercises that they give you on your own and when you go to PT so you can get better faster and get the right recovery steps. And mind over matter, so know that you can do it even when you think you can't, because your mind is everything and it tells you tells you what you can and can't do. So, and then imagery, so like imagine yourself getting back on that field and doing better than you could have ever thought, and like you're going to heal from that injury and you're going to be better than you were the last time and you're going to work harder. Have good breathing techniques as well. So when you're like stressing that you can't do it, so basically just take 3 breaths in and then 3 out, and basically just get that stress out of your body. And as you see like this picture, it's basically just like how people feel like mental distraction, optimism, mental imagery. So basically just like these things can like help you like maintain with like stress. Yes, like help you cope with it. So how an athlete feels during an injury. It gets very hard for athletes to comply with the PT program because like they always want to be back sooner than what they think, because they feel like they know their body better than themselves and the doctors don't know. And then some athletes are really scared to go back out there because they feel like if they get back there and they get re-injured or injured worse, they feel like they don't know if they could ever play again, which that's really scary too. But you can't think like that really, because if you think like that, you're just going to be stressed and scared the whole time. So, and people say like if you can control your breathing, like it can help with your sleep. relieve a natural pain and help the athlete take over this injury. So like breathing's really big, and it can help you really just take over this injury and just like get some stress off of your system. And so by having an injury, it can also have an athlete's anxiety go up even higher, because it can be like, as someone like dealing with the loss of a loved one, because it's like, am I ever going to be able to get back on the field? Am I ever going to be able to play the game that I love, like be with my teammates? Like, yeah, you're with them and you're like supporting them on the side, but it's not the same when you're not on the field. So it's just like really hard, because like it's like they lost something that they really loved. So yeah, and then this is our conclusion.
This brings me to synthesis and conclusion. Injuries are hard and can happen to almost everyone. It's all part of athletics, and injuries do happen, and it can affect you psychologically, physically, and behaviorally. By relying on coping methods and limiting stressors in life can help lower your risk for injury, such as positive attitude and patient education. Some questions to think about at the conclusion of our presentation is, what have you done to limit your stressors, and which coping methods work for you? Maybe think of ways to improve what coping methods you can implement to your life to help aid in this. And then, do you think there's a link between personality type and athletic injury? Thank you.